Hi, everyone. It's another week of Doc Talk, and it's a good week of Doc Talk. As you can tell where I am now, the sun is shining. We're kind of in between weather fronts. For February, that's a really good thing to have happen. Some of you still digging out from some winter weather events. And we need some more precipitation coming across the country for water reasons that will be really important. This morning, one of our discussions on wildland firefighting and preparing for that already this year. So we do need some precipitation, but we don't need more ice or snow in Texas. How's that for the Texas people? So we've had a good week of progress in COVID, and that COVID progress is generally around people getting infections that are not too severe. In most regions of the country, the hospital and healthcare systems are able to manage it. The management of wintertime volumes always tough in hospitals. This year, with the added burden of COVID, a number of hospitals had to quit doing elective procedures, which dramatically impacts people's health in the long term, but was necessary to keep the health system up and running. Most health systems are reporting fewer people off sick, and that's really good news. So then their staffing works a little bit better. And then not as many people on vacations at this time of the year, including in the healthcare arena. And it's just not as much fun to be traveling right now because a lot of places kind of shut down. And so we're going to get through, I think, about the next 4 to 6 weeks. And then I think we'll be in a much better stage. I could show you a graph, but just imagine that right now in most areas of the country, COVID infections are on a serious decline, a very steep decline. And nationally, the numbers are a third to 40% reduction in the number of cases. There's been a less dramatic drop in hospitalizations, and still we are keeping the deaths about the same, but the deaths frequently are in older people and people who have underlying medical conditions. Each one of them a loss for us, but it is not that we are at this point having high fatality rates from coronavirus in people who are otherwise young and healthy. Young people still getting COVID, and because the Omicron variant, it really likes kids better than the earlier variants did. There's more children who've had infections, but they have not been dying in large numbers. That's a good thing. Another piece of good news this week is that flu across this country is on the decrease. So we for, let's say a month, we had the flu rate increasing. It was the influenza A, H3N2 type, still one that is going on, but now the flu is coming down, and we're really getting late in the season to have any kind of major uptick in flu volumes. So good news. So this week we're going to talk about a couple of things that are really important to you. How about getting back towards normal? And the number one question, Doc, when are we going to be able to take our masks off? When can we get our masks off? In the winter, sometimes not so bad wearing a mask around. And I really like my heavy cloth mask in cold winter air anyway. This helps me breathe a lot easier. We did airway in our EMS refresher this week, and we talked about the purpose of you having this complicated respiratory system up here is warm and humidify the air on these bitter cold days. And this really helps you do that. So this time of the year in many areas of the country, not so hard to wear masks, but we're 6 weeks away from spring and we would like to be out of these masks. So can we do it? So here's the keys. Where is COVID in your community? If it's heading down dramatically and you're not seeing infections in your peer group, which would mean in your fire EMS service, in your public safety force, in your entire city or county or municipal employees, in your school system, in your other work groups, et cetera. That gives you an indication that Omicron is kind of running its course and has run through as many people as it can, and it's not going to be as prevalent in the air around you and enclosed places. Omicron's still not well past out in cold moving air. That simply is not how this virus wants to pass. So in places where you have serious declines and where the rate in the community has gone low enough, we will begin to see our public health officials, but then more importantly, our leaders, so our chiefs and others saying, we're going to begin to reduce mask utilization. So the first mask utilization typically is done in the communal areas of our stations and in our vehicles. So that's the number one place where we can begin to reduce. So based on the fact that people are not coming to work sick, and that's a really important assumption and really important in your behavior, don't go to work sick. Don't go febrile. Don't go sneezing and coughing. Don't go when you feel like you've been completely washed out and been running a fever and chilling all night long. Not the time to go to work this year. All right. So based on the people, don't go to work sick. Then we can begin to reduce our use of masks across the stations and in our vehicles. So that then, in an area where people are not sick amongst each other, and in particular in places where everybody is vaccinated or had their immunizing events, including being sick, we can begin to reduce the use or eliminate the use of masks in our communal areas and with each other. Still a very good idea when rates of passage are high enough in your community, when you're out in the public area. So you're going out doing your shopping for your duty day. You're out teaching in the schools, and the schools still have masks that we put our masks on. And those, in this case, are simple surgical masks. All right. For the time being, the use of N95 or KN95 masks for doing patient care, still a great idea until you get to significantly lower levels. So again, we have seasonal use and use out in our routine stuff in our daily lives. In the situation where we're doing patient care for non-affected patients, or out doing our public work, which we still have to do, we still use surgical masks. And doing patient care, we're still at N95s for now. The next step would be to reduce the utilization of this in all but patient care settings. And then we would go to patient care settings where there is no risk of COVID. So you go to an injured patient, the majority of your staff would be able to drop these, okay? Particularly vaccinated staff would be able to drop these altogether. You would still, for the time being, for a patient with respiratory problems, so difficulty breathing, cough, and fever, still a great way that we're going to be using PPE, even through the summer months, and I think in the next fall, KN95s for people at risk. You would be doing this anyway if there was never a COVID for patients who had things like meningitis or tuberculosis. Our use of N95 masks still very important on a day-to-day basis, COVID or no COVID, when we think we have meningitis, tuberculosis, and other serious respiratory infections. We will finally, I think this summer, be able to drop the requirements down for masking to where it is KN95s with those with symptomatic respiratory infections and masks off for other patients. Although in bleeding patients, disruptive patients going to spit at you, eye protection and a protective mask still a great idea. So let's think through those phases. And right now I'm writing policies that will be implemented in my department starting next week. Our community rate has dropped so significantly in our community that next week we will be dropping down to mask for patient interventions and when in congested public areas. And those will be either simple masks, surgical masks, or our KN95s for doing patient care. The next policy change will be we don't need a mask around patients who aren't actively bleeding, spitting at us, or have any illness. And then finally, we will get down to KN95 or N95s only for patients with respiratory symptoms. What we do next fall will be very interesting because I think a number of you will want to be wearing masks again and prevent yourself from getting respiratory infections when it comes to patient encounters, let's say November, December. Let's get through to there, okay? Let's be really safe. Let's find a way for our communities and our departments to get out of this current wave. So number one for you is stay home if you're sick. Number two, still washing your hands, keeping your hands away from your face. If you do have to sneeze or cough, you do that into your elbow, and good hygiene around the stations. Be very careful in patient encounters. I'm just going to make you aware, we still have another 6 weeks or so of winter. There will still be other respiratory infections, and you still want to protect yourself. This is the way to do it for any of your patients who have pneumonia or a respiratory infectious illness, even if it's not COVID. KN95 on you, still great protection. Some eye protection on you, and then a gown if they're coughing violently and can't control themselves, etc. Still be careful with giving neb treatments. We're going to be talking about spring stuff soon and giving neb treatments. Imagine you handing somebody the nebulizer, standing in front of them as they are taking their first couple breaths, and they always have to cough. And of course, they don't have the mask on and they cough right at you. If they have some infection, then you're like, I'm in the stream. I don't want to get sick. And that's not even COVID related. That's just good old fashioned common colds and bronchitis. So we're going to make it through. You have stuff to look forward to. It is a much better time when we're talking about the down slope of the curve, telling us about incidence. We are waiting for even further decreases that look like this in the hospitalization rates. We're looking for more capacity at our hospitals to reduce the load on the EMS system. And then we're looking for decreases, which will be much more gradual, in the death rate in our communities. It is really good that we are not seeing daily reports of fire EMS personnel dying in the industry. And we are at that point now where we are not seeing that same impact. And I'm feeling it in the services that I'm affiliated with. We just have not had the serious illness. We've not had the deaths as near as frequently in the community, and we're going to get through this. So everyone, let's get through winter. Let's enjoy what we have of the cold time. Let's plan for some good times ahead. When we're in and amongst each other without a mask on, when we're having fun, when we're taking vacations, which we all need to do, getting into the warm weather times, and let's get there, okay? DocTalk, February, great time. Keep it up. Thanks.